There is only one person who can bring life in this world and save life from leaving this world. For them, stethoscope is not just an instrument, it's a jewelry. Yes, dear doctors, you are real life heroes. A coruscating morning to the dazzling cluster of invited guests. It's a day full of joy and exhilaration as St. Edmunds celebrates the National Doctors' Day. Such a great day celebrated to esteem our memories throughout life. I, Mamta Sharma,
And I, Ayushi Sharma.
feel profusely elated to offer an astounding and inclusive welcome to the doctors panel from various parts of India who, in spite of their busy schedule, graced this occasion. And today, amidst us, we have Dr. Lalita Kanodia ma'am. She is Senior Consultant, Department of Pediatrics, CK Birla Hospital, Jaipur. She has done MD in Pediatrics and DCH in CPS. She has earlier worked in Fortis Escorts Hospital, Jaipur. Her areas of special interest include asthma, epilepsy, and learning disabilities. Her paper on celiac disease has been accepted for publication in the reputed journal Indian Pediatrics. Wow, a rapturous welcome to you, ma'am. We extend
Good
our
afternoon.
real ovation to welcome the very famous doctor from Sikkim, Mr. Monish N. Chhetri. He is an otolaryngologist, head and neck surgeon, working as a consultant ENT specialist in Central Referral Hospital, Gangtok. He is Associate Professor of ENT in Sikkim Manipal Institute of Medical Sciences. He is also the State Secretary of Indian Medical Association Sikkim State Branch. He completed his training from the Regional Institute of Medical Sciences, Manipur. We offer a convivial welcome to you, sir.
Good
We feel
morning. Thank you.
honored to extend a gracious welcome to another renowned personality from Jodhpur, Dr. Bharat Paliwalji. He is Associate Professor, Anesthesiology and Critical Care, AIMS Jodhpur. He holds many additional educational qualifications apart from doing MD in anesthesiology from MNAMS. He is being felicitated with many awards and appreciation by many famous awarding bodies. He is member of many committees like ISCCM Jodhpur, Indian Society of Anesthesiologists, to name a few. This genius mind has published 49 international and national journals. His field of special interest remains pain management, intensive care, obstetric anesthesia, cardiac anesthesia. Wow! Once again, we take immense pleasure in welcoming all the luminaries, students, teachers, parents, and everyone, all the viewers who are watching us live here right now to celebrate the National Doctors Day to pay tribute to our real life superheroes. Also, we have with us the precious pearls, two students representing the Students' Council of St. Edmunds, and they are.
Good morning, doctors. This is Samriti Pandey of class 11 science.
Good
And
morning, doctors.
Good
Myself,
morning,
Priya
ma'am.
Bharati from
Good
12th
morning.
standard.
Good morning.
Good
Good
morning.
morning.
Good morning.
Thank you for
Welcome
the
to
kind
this
words.
welcome everyone. Yeah. So now I'll invite Priya Bhati to apprise all of us about why the Doctors Day, National Doctors Day is celebrated. Over to you, Priya.
National Doctors Day is observed on July 1st in India to commemorate the birth and the death anniversary of respected physician and the second Chief Minister of West Bengal, Dr. Bidan Chandra Roy. Roy was born on July 1st, 1882 and also died on the same date in 1962. Born in Patna, Bengal, Presidency, British India in 1882, Dr. Bidan Chandra Roy, physician, a freedom fighter, an educationist, and a politician. And the government of India established Doctors Day in 1991 to recognize the contributions of a man who served CM of West Bengal for around 14 years. From 1948 till his demise in 1962, he played an important role in the establishment of MCI and IMA. The day is celebrated every year on the 1st of July as National Doctors Day. This day is celebrated to acknowledge the role of doctors in the progress of this nation. Thank you.
Thank you so much, Priya, for giving that information. Now let's have a look at the video prepared by our students to pay a tribute to the real life heroes of our life, the doctors.
You are the true heroes, not because you are fearless, but because you overcome the fear to save lives. You are not the foot soldiers, you are the knights in the shiny armor.
I just wanted to take time to express that how grateful we all are to every single doctor who are working on front lines to protect our nation from this pandemic. The healthcare workers, doctors and various other staffs, we bow down to you for putting yourselves and in turn your families to risk. When one consciously risks one's life for the well-being of others, that is really worship worthy. Thank you for being such great people and for making sure that all of us are safe and healthy.
Thank you for putting your lives in the way of danger to save others, to save public. This is what it means to be a hero. This is what it means to build a beautiful legacy. May your days be wonderful and happy like you make it for others. You are an incarnation of God for others. Thank you. Happy Doctor's Day.
There's a saying, we pay doctor for his struggle, for his kindness, but we still remain in his debt. That is factually and morally true, because you guys sacrifice each and everything for your patients. Thank you for taking such care of your patients. You guys are really the God in person.
Thank you to all the doctors and nurses out risking their lives to save others. You are amazing, and I hope you all are stay safe during this pandemic. Once again, thank you for all that you are doing to keep everyone as safe and healthy as possible during this crazy times.
Excellent.
Thank you, students, for such great tribute. I would like to now invite Dr. Lalita from CK Birla Hospital to enlighten our viewers with her kind words of wisdom on the occasion of National Doctors Day.
Namaste everyone. I'm Dr. Lalita from CK Birla Hospital. I'm a pediatrician. So this pandemic, everybody has been going through. This is the second phase of the pandemic. Everybody is affected, from children, parents. Every one of us has been affected by this. So children, two words of this thing for you. I understand it's a tough times. You have to be at home. You all can't go out and play. It is playing psychologically also. But this will pass. Even this will go. Times will come back. You will play again. And so be positive and try to do as good as you can of the present situation. Ups and downs are a part of life. What I would recommend is that since it's all online teaching, keep your posture straight and do include exercise, be it skipping at home, being at yoga at home. Some form of exercise should be there. For parents of these lovely children, it's fine, you help them psychologically. They do get irritated, they cannot play. Imagine 2 years of your life you're stuck inside a house. So do understand them, do not get angry. There's no need to show unnecessary gory details of the pandemic. If you teach them in a simple words, that is more than enough for them. And do take care of their diet. Like this pandemic, I saw, in the last wave, everybody was into cooking. And cooking, not healthy cooking, all sort of cakes and pastries and I don't know what. So do think whether you're feeding your child right. So whenever you cook something, think about the calories, think about the protein. It's not that ab khilane ka mauka milta hai to khilate jao. So no, think about nutritious food and of course exercise. You should include it in your lifestyle so that children include it in their lifestyle. Spend time with them, play with them. Think of it as a family time. And overall, COVID precautions should be taken. Now there's a third wave supposedly coming, which is supposed to be in children. Now see, children you can stop. आप बाहर नहीं भेजोगे तो वो घर पे रहेंगे. बट आप बाहर जाओगे और आप उस वायरस को घर पे ले आओगे. You are vaccinated, you may not get affected, but you will give it to your children. So parents, COVID precautions have to continue even after vaccination. So please do take care and be safe and protect your children. Thank you.
Thank you, Lalita ma'am, for your words of wisdom. Now, I would like to invite the otolaryngologist, Dr. Monish N. Chetri from Sikkim, to kindly enlighten our viewers with his words of wisdom. Thank you.
Good morning, everybody. Good morning, Ayushi and Mamta and Priya and Samriti and all the students and maybe the faculties who are watching with us. Thank you for inviting us to the Doctor's Day celebration to your school. Ma'am has already talked a lot about COVID and precautions. Let me talk some around COVID. Many of you might be interested to become a doctor. So you might be studying in 11 and 12, and if you are studying science, I'll just tell you briefly in Indian scenario, how can you become a specialist? How can you become a doctor or a super specialist? What studies you need to do? How do you go about it? And very, very briefly, I'll let you know. So the basic degree to practice medicine in India is known as an MBBS. So that stands for Bachelor of Medicine and Bachelor of Surgery, which you will have to do after your class 12 in science stream, having biology as a subject. So after that, you have to study for 4.5 years of college study, which will include hospital visits and all those things. And then you have to do 1 year of a compulsory internship in the hospital in a medical college. So after 5.5 years of doing that, then you will be registered in one council, either in your state or in Delhi or wherever. And then you will become a basic graduate doctor. So that makes you a allopathic doctor in India. So to go for this, you can study in any of the medical colleges in India through entrance exam that is called NEET, which you have to give after your 12, you must be knowing. So there is another way for this also. You can go and study in foreign medical universities in outside India, like China has become very popular nowadays, Russia, Ukraine, many people do study. So although the system there would be a bit different, maybe it will take a year more or something, but when you finish that one there, then you come back to India and you have to give a licensing exam. And after you give a licensing exam, no matter what degree you have done there, you would be considered as an MBBS graduate in India, and then you will be a graduate MBBS doctor. So after that, you can practice as a general physician, and you can work as a medical officer in the government, or you can work in hospitals, private hospitals, government hospitals, anywhere else. After that, again, to do your further specialization, then you do what is known as a specialization or a post-graduation. So for that one, what you have to do is, again, you sit for an entrance exams, and then after giving the entrance exams, then you have to do a 3 years course, depending on what subject you choose. If you choose something to do with surgery, like me, I've chosen to do something in ENT surgery, or somebody wants to do an eye surgery, or somebody wants to do a general surgery, orthopedic surgery, then you get a degree which is known as Masters in Surgery, that is MS. And if you choose to do something else, like a physician, like a general medicine physician or a pediatrician or a pathology or something like that, then you get to do something known as a MD, that is Doctor in Medicine. So these 2 degrees are the basic qualification. Other than this, also you can do, there's another way you can do is something known as a DNB, that is Diplomate in National Board, which is considered equivalent to MD and MS, and it will be almost the same thing. 3 years of studies and the exam after that, and the 3 years of study will be more or less working in the hospital rather than just sitting and attending classes. It will be more than working in the hospital. And after you complete your 3 years, then you can again get additional registration in your council, and then you become a specialist. Furthermore, if you want to do something, you want to become a super specialist, then there are certain areas like cardiology, nephrology, and then so many other areas where you have to do another 3 more years. So depending on whether you are a surgeon or you are a physician, so you have to do further 3 years of DM or MCS. And suppose you are a general surgeon and you specialize, say, in cardiology, cardiosurgery, cardiothoracic surgery, vascular surgery, then you become a cardiothoracic surgeon. You are not a cardiologist, you become a cardiothoracic surgeon. Then similarly, if you are a medical MD medicine, and if you do 3 years of further studies in only cardiology with a DM degree, then you become a cardiologist. Similarly, for the kidney, you can become a nephrologist if you're a physician. You can become a urologist if you're a surgeon, something like that. So that is how you get to become a specialist or a super specialist in India. So if any of your friends or if yourself, if you're interested to become a doctor and serve, then this is the way to go about. And thank you, everybody.
Thank you, Dr. Chetri. And now I would like to call upon Dr. Paliwal for sharing his important piece of words with the students and teachers and other parents watching the live stream.
Good morning, all. First of all, thank you. This is St. Edmund School for inviting me and interacting with you all. And thank you all students, Priya, Samriddhi, and who all have contributed for that excellent video you have prepared. And I also like to thank your principal, Mrs. Monica Bhati, and academic head, Mr. Dipen Singh, for giving this opportunity, and the very nice host Ayushi, Mamta, and Mayuri. Just a brief, Dr. Monish has all briefed you about your academics, how you to go about that. In short, you reached to class 12 in 12 years. Again, you need another 12 years to get a doctor, master's, MCS degree. And there are, as the time progresses, you will get to know about all that. Your basic preparation starts from 10th onwards. And so be aware how to proceed from that. And second thing I would like to say, since this is a COVID time and all, this lecture is organized on that, every good or bad things passes away. So if we go back to the history in 1918, there was a Spanish flu, and it was exactly the same. If you go on Google the Spanish flu in 1918, you will say same photograph, same picture, same mask wearing, everything was there, but it passed on. So it took 2 years to go up. Probably this will also pass off. So there is an end. There is an end. So be hopeful. Continue to practice the COVID guidelines and protocols, and be safe. And what else I would like to say is there are, although everything has been highlighted worse about the COVID, but the good part is now you can connect it to everyone sitting at your home. We are with you right now with this web. You can get information from any school, any university, sitting with a click on your phone. You can do multiple courses. So there is you can nurture your extracurricular activities. So there are a lot of positive. You can connect to so many friends just by sitting on your phone. So there are good things about it. Be hopeful, be positive, work on yourself, build yourself academically, physically, and good wishes to all.
Thank you so much, Dr. Paliwal. Now let's move ahead with the question and answer round from our Students' Council, wherein our students will be asking you all the doubts and questions that they have in mind. Over to you, students.
So now I would like to ask Dr. Chetri that what are the new additional symptoms of COVID-19 that have been found lately?
Okay, hello. Regarding the symptoms of COVID, no, there are actually no as such new symptoms that are coming, but actually what is happening is we have found out that there are some other presentations of COVID. Like previously, when the COVID first started, it was just thought to be cold and fever, and everybody was focused on fever, right? So if you didn't have fever, like we are not thinking of COVID, then slowly we found out that there are other systems which are involved more. Sometimes what happens is the patient presents a bit late, so some symptoms get masked, some symptoms are not presented earlier. And then over the time, we also found out that certain symptoms which were earlier not detected, it might have been there, but it was not detected as having due to COVID, like diarrhea or like loss of smell. In the first few months, we did not think of loss of smell as a symptom for COVID because it was not reported much. Later on, we found out that it is a very, very reliable symptom for COVID, right? Loss of taste and loss of smell. Similarly, diarrhea, single episodes of diarrhea. At first, many people maybe did not report a single episode of diarrhea, thinking it is just a part of their daily thing that something has happened to them. But later on, it was found out that a single episode of diarrhea is quite cleansing for COVID. So, like that, newer symptoms, I would rather say that it is the same upper respiratory tract infection spectrum, that having a cold, a stuffy nose, a headache, running a fever, definitely yes. Then cough, a kind of a cough which is persistently not getting better, getting worse. And then GI symptoms like single episodes of diarrhea and all these things. So these are the symptoms that has been presenting. And
I would just like to add that there is a myriad of symptoms that can be presented. Even it can present as conjunctivitis, also general myalgia, also.
Yes.
So it's difficult to predict, but most common symptoms are the one which you commonly hear of.
Thankfully, in children, it has not been much. It has been a mild course, only a day or two of fever. Not many symptoms have come up in children. So, this wave 2, I mean, there were symptoms, but not as bad. But the symptoms are similar, as Sir said. And fever is mild for a day or two.
Thank you. Now, I would like to ask from Dr. Paliwal, sir, how much effective is the recently discovered DRDO anti-COVID drug 2DG medicine?
This 2G medicine has been shown to be effective in studies that has been conducted not on patients but as a part of some research work. The drug is in the market and it takes time to build evidence how long it will be effective. So currently we are not in a position to say that is it too effective or it is not effective. We have to see and we have to wait for the results to come. So some trials are also going on to know what the efficacy of the drug. Let's see what the results come out.
Thank you, Dr. Paliwal. And now I would like to ask Dr. Lalita. Due to this virus, children and students like us are hardly able to step out of our residences, and this had been affecting the young minds. How do you think about it?
So, Samriddhi, it's true that being at home only, not interacting with the outside world, that has affected children. If I put it in a phased manner, like, so there are children who are toddlers, so 1 year to 3 years. Now, these children do not go out to park to play, so they have not developed bonding. So, what I see in parents coming to me is that, "Ma'am, मैं किसी के पास जाता नहीं है." They are not ready, or they start crying in crowds. Some of it is acceptable, say 9 months to a year or 1.5 years, this is known. So stranger anxiety is known, but now they are not wanting to interact. Going anybody's house, they will keep crying. So this is probably because there has been no interaction other than other family members. Little older children, say 3 years to 5 years, these are children who are very active, want to play, or even may take up to 8 years. They are stuck at home. So irritability, anger, chidchidapan, not wanting to eat, getting extremely ziddi, in other words. So these are all features which are seen in little younger children. Children of your age, teenagers, are not getting to interact with friends. So the world where you develop relationships, where you understand each other, that each person has his own being, has his own personality, these things are you are not able to interact. So these features are seen in children, but everybody of us is going through this phase. We have to be as best support each other. Parents in fact play a greater role. Try to be more supportive, more positive. Do not push your children towards ki dekho wo aisa karta hai, dekho ye aisa karta hai. It's not so. Whatever we have, try to build on that, I believe. So it will pass with time. Children, the good thing about children is they are changing. That's the difference between adult and children. Adults fixed ho jate hain, be it mentally, be it physically. You don't grow much, but children change and grow. And so after these 2 years, 3 years are over, you will grow back in flower again. So do not worry.
Thank you so much, ma'am. Now I would like to ask Dr. Chetri. People are getting corona positive even after getting vaccinated. Why?
People are getting positive after vaccination. So this question has been asked by a lot of people, and this has caused a lot of upset among the people to get vaccinated also. So the very basic thing out here is that the vaccination, especially the vaccine that we are using in India, Covishield, it has been found that it does not prevent 100% infections. It will prevent up to 70 to 75% of infections. But what it does prevent is that it prevents severe complications from the disease. So even after getting 2 doses of vaccination, one thing can be there that after taking 2 doses of vaccination, the second dose, and then a lot of time has not elapsed since then for your body to develop immunity, and you can get infected. Secondly, even after the immunity has developed, there is a little bit of chance that you will get infected. And in fact, some of our colleagues here in the hospital have got infected after 2 doses of vaccine. But what has happened to them is that they had a very, very asymptomatic kind of disease, or a very minimal symptom of the disease, and they did not have it very severity of the disease. So what people should understand is that even after 2 doses of vaccine, we can get infected, and we should not be scared of taking the vaccine because of that reason. We should take the vaccine because even after you get infected with 2 doses of vaccine, the severity of the disease, for your chances of you landing up in the ICU and the chances of even getting hospitalized comes down very much. So
I routinely vaccinate children. So no vaccine is actually 100%. Most will be 80, 90%. Few may go up to 90, 99%, but most will be at around 70, 80%. But the course is definitely milder.
Thank you, Dr. Chetri. Thank you, Ma'am Lalita. And now I would like to ask Dr. Paliwal, how many variants of coronavirus are present at the present time, and why do you think that the Delta variant is more dangerous?
Samriddhi, there are many variants. Actually, what happens when a virus gets infect a human body? So it integrates, it clubs with the your body cell, and when it multiplies, there are minor changes in the copies. So the copies are not exactly the same as what was the parent. Okay, so there are certain minor variations. Few increase the infectivity rate of the virus, few decrease the infectivity rate of virus, few increase the severity of illness. So this is what is meant by a variant. Okay, so as there are multiple multiplications, multiple hosts, so minor changes are bound to occur. But few are good changes, few are bad changes. Okay, so that are known as variation of interest. Okay, and there are multiple variants. There is an international agency to name the variant. It is deliberately named as alpha, beta, delta, so that there is no regionalization, no community message is being passed on. So that's why there are theta also, there are epsilon also, there are multiple zeta also. So at least I can name 10 to 11 variants that are available. Regarding this Delta virus, or what is coming up is Delta plus virus. So it is proposed that they are likely to be more infective, and the disease severity might be high. So one thing I would like to just tell you before for each, and it is a blanket statement, that majority of data is still evolving. Although we had been seeing COVID from last 1.5 years, But currently there are only few things that can be precisely said. The rest, the data is evolving from whole of the world, so things get on updated very fast. The whole world is connected on a common cause, so information keeps on piling up from here and there. So the current information gets old in another 2 days. Okay, so it is assumed that seeing the surges of cases in UK, that this Delta variant may be more lethal, more infectivity. So this is just a presumption. Okay.
Thank you so much,
Thank
sir.
you.
Now I would like to ask from Dr. Lalita. It has been observed that COVID-19 was at peak during summers, both in 2020 and 2021. Is there connection between the virus and season?
Frankly, the virus is not following any seasonal pattern as such. Even in cold countries, it is affecting. Even in hot countries, it is affecting. Probably in our country with monsoon, humidity does play some sort of a role, and in humid conditions, uska transmission has been found to be little lower. But this virus per se is not following any norms like a natural virus. It is present in almost all seasons per se.
Just I would like to add that it's just that in cold you get viral infections, you get common URIs also. So that sneezing part is there. So that increases the communication rate between two different persons who comes in close contact. Whereas in summers, such illnesses is less, so transmissibility is because of this. So this may be right reason, but otherwise, what Madam Lalita has said, it's right.
Thank you, Dr. Paliwal. Thank you, Dr. Lalita. And now I would like to ask Dr. Chetri, does the Delta Plus variant affect the people who are already vaccinated before?
Whatever data has come till now, no, like regarding the Delta variant, the first of all, like all the places we have not been able to find out which variant is in like abundance, and secondly, the Delta variant has been shown to be having almost similar characteristic other than a little bit of more infectivity. So the vaccine, from what the producers of the vaccine, the Serum Institute, they have said that the Delta variant will also be effective in the same lines as the normal variants of the coronavirus for the Covishield vaccine. For other vaccine, we do not have much data in India because most of the patients in India are vaccinated with Covishield, the majority. So according to the manufacturers, that is their Serum Institute, according to the data given by them, the Delta variant will also be as effectively inhibited by the vaccine as others.
Thank you so
So we
much,
cannot,
sir.
yeah,
Now,
we cannot expect 100% efficacy against the vaccine for any variant, be it alpha variant or any variant. But definitely, yes, there is some efficacy against all the variants.
thank you so much. Now I would like to ask Dr. Paliwal, sir, can one take a cocktail of both Covishield and Covaxin?
Priya, currently, what is I just said the blanket statement. The evidence is evolving. So, as per guidelines, you should receive only the second dose of the vaccine which we have received the first dose. This is the policy. So, whatever now, how this idea of getting a second dose is coming is that in few countries they are getting a shortage of supply or there are some resource issues. So, because of this reason, they are doing some clinical trials to see whether that can be second can be given instead of not giving at all. So it is because of their circumstantial issues. So they are doing some clinical trials to see that. But as far as we go by the national norms or by the what the WHO says, we should get the second dose of vaccine of the same dose from manufacturer from which you had got the first dose. Although few data has come up is that it is equally effective but still you should go for the same manufacturer. Yes, Dr. Lalita.
So like we vaccinate even in children. So the boosters or generally the primary series should be the same vaccine, as sir said. It is not the common mentality ki thoda iska bhi le lo, thoda uska bhi le lo, and the effect will be more. It's not so with vaccines. In fact, if you give the same vaccine, then the antibody formation against that particular antigens are better, and so the efficacy is better. But as sir said, studies are evolving. We still don't know the virus completely. So if you don't have, or if it's a mixed vaccination, jo milta hai wo le lo. But if it's a choice, then you should take the same vaccine.
Thank you, Dr. Paliwal. Thank you, Dr. Lalita. And now I would like to ask Lalita, ma'am. Ma'am, it is being assumed that the third wave would, in the third wave, children would be more prone to COVID-19. So is it true? And if it's true, what would be the incubation period for the children?
So children, let me start with the second part. The incubation period is almost the same, be it children or adults. It really does not change. The third wave being more, this thing is a postulation, or hypothesis hai, because the elderly have been vaccinated, the middle age have been vaccinated. Now those who are left is actually the children. So probably the other two age groups will get a milder form, and the brunt will be borne by the children, is what is thought of. But it may not completely be so. So what we saw in the last two COVID waves is that the virus per se uses our own immunity against us, and thereby causes lot of harm and damage. But in children, say less than 5 to 7 years, the immunity itself is pretty low. I mean, it does not, that is why they get infected so commonly. So probably the virus may not be able to use the same trick in children as effectively. But yes, older children, say 8 to 15 years, are more likely to get this infection. Plus children of this age or of your age will not sit at home, want to go out, want to cycle, want to play. So thereby also they get exposed more. So the way out is that parents and children both should take COVID precautions, stay at home, do not unnecessarily go out. Going out for work is acceptable, going out for holiday is not acceptable, and without mask is not acceptable. Second thing is what I would just put as a gist is the MISC, that is multi-inflammatory systemic disorder, a late complication to COVID infection of the second wave. So this comes around 6 weeks to 8 weeks after the primary infection, and it is because of antibody. So ye spread nahi hoga, but that particular child may have fever and symptoms of redness, rash, and a little rough course, but iska bhi percentage kafi kam hai. So we need to see in the coming wave whether it is going to be MISC or it is going to be COVID itself, which is going to give us trouble. But I believe less than 7 years will be okay. 7 to 14 years are like adults, you should take it. Your view, Bharat sir, what is your view?
Madam, you rightly said that it is just the exposure and the vaccination status that has prevented the elderly in the second wave, and more of the young patients were affected. And probably that may be the reason for the third wave. Again, I would say it is unpredictable. You can't, we cannot say that the children will be the affected. It's general that those who are not vaccinated, those who are not following the COVID protocols, they are likely to be infected. So nobody is fair. The other age group should not think that the third wave is only for the children.
Thank you, sir. So now we would like to take questions from the audience. There are many questions floating here. So I'd be taking one question, and we have here regarding the ivermectin and its usage as a prophylaxis. So it says, do you think it is valid and beneficial for such usage? Who would like to answer for this? Yes, sir.
Yeah. As such, what measures have been shown for prevention is your hand hygiene, social distancing, and mask. From the treatment part, not much of the benefit has been experienced by us at our setup. So, and the basic treatment is different from all the drugs which you have mentioned. So right now, we are not following ivermectin or doxycycline, anything in our treatment protocol right now.
Thank you. Yes, sir.
Okay, now we have a question from a student of class 5th, Bhavna Meena. She wants to know, sir, when will we be able to go back to school? And is this going to get over someday? Children are
Class
curious.
5 child is
5
asking.
child.
Bhavna, we had all said in the very beginning that bad things pass away soon, and once we all get vaccinated, probably the transmission will reduce, and you will be able to get back to school soon. Till that time, just follow your advices given by the parents and teachers.
True. I believe probably till the third wave ka kya hai, I doubt schools will start so soon. I believe children who are the only children at home, I mean the only child, they don't have siblings, they're the ones getting really affected because koi khelne ke liye nahi hai. So parents do try to play with them. It is fun. You can become a child again when you play with a child. So do play board games and stuff like that. If you are in a society, what I would say is probably going cycling with a mask on is still okay, or playing games like badminton where you're far apart, ek dusre se dur ho, you're wearing mask and you don't run too much in a badminton. So these games are still okay to give them some sort of relief in this lockdown or 2 years ka jo ghar pe band rahe hain. So these games are still okay for them.
The natural light and fresh air, they do have a positive impact.
Thank you, ma'am. Thank you, sir. Dr. Monish, questions are floating here. So I would like to take up one question from the audience. It says that after getting negative, patients, after how much time should they be vaccinated? What is the safer time limit?
Okay, so yeah, this is also one common buzz question, because many people the question is like after testing negative or after recovering from COVID, basically. So after recovering from COVID, according to guidelines in India, we are recommending in 3 months. And basically why it is because when the patient had COVID, there was some amount of antibodies that is developed in the person, and that antibody, although may not be as strong as what the vaccine will develop, but it will definitely stay in the body for some time. So what it does is, if you get vaccinated that time, in that period, there may be a chance that the vaccine may not be 100% effective. So the vaccine is an antigen that stimulates the production of antibodies. So when you already had antibody due to the COVID infection and then you get vaccinated during that time, there are chances that the vaccine, number one, the vaccine may not become very effective. Number two, that there may be some adverse effect arising out of that. So to prevent this one, and another thing is, since you already have antibody, there is very less chance that you'll get COVID in this first 2 or at least first 2 to 3 months. There are very less chances of getting COVID again. So the safe thing is to get vaccinated after 3 months.
Okay. Thank you, doctor. Today in morning when I was coming to school, I heard a news that Zydus Cadila, they have launched this Zycov D. They have asked for emergency usage for vaccinating children from age 3 to 18, I guess. So these vaccines for trials, are they going directly for trials for the students? Is it like that?
No, for what I have heard, what I've seen or read till now is that Covaxin, that is our indigenously developed vaccine, is undergoing phase 2A and 3 trials for 2 to 18 years of age. So basically what these trials are like, there are various phases of a trial. So in the later stages of the trial, that is a phase 2B and your phase 3 trials, yes, definitely the age group that is intended to be used will be used for the vaccination. But what it is being done is that a certain level of efficacy, a certain level of safety of the vaccine has already been established before that by doing tests on other, maybe on animals or on something else, and then only we are going to vaccinate the children group. And moreover, this group which is undergoing a trial will be very, very closely monitored. It will not be like a normal vaccination campaign. They will be very closely monitored, and any data coming out of that will be utilized for creating the future guidelines. So I think yes, trials will definitely need to be there, and then Covaxin is undergoing a trial and maybe get approved in a couple of months for the 2 to 18 years of age.
That's nice. So another question we have from our student Karthik Devnani. He's asking, what about the other vaccines like Covaxin and Sputnik? How much effective are these, and what is the difference between all these three vaccines? Covishield, Covaxin, and Sputnik.
Basically, there are 4 or 5 different techniques of manufacturing a vaccine. So all these vaccines, they are different in the mode of their manufacturing. Some are using the mRNA sequence, some are using the capsule part, some are using another host like a chimpanzee virus for the generation of the vaccine. So these are different techniques of generation of the vaccine. As such, there is no head-to-head trial. What I say, the data is evolving. Huge population is getting vaccinated with Covaxin. Although all these have undergone a certain mandatory tests passed for their safety and efficacy. So all are shown to be effective, and they are being given to the public. And the time will only tell, and few clinical trials when their results are out, that which will be better. Anyhow, currently all are equally providing efficacy, and whatever you get access to, you should get vaccinated.
Thank you, doctor. Monish sir, I would like to ask, who are more prone to this mucormycosis?
Okay, I will answer that. Basically, mucormycosis is a fungus, and it's present in the atmosphere surrounding everywhere. Me, you, every healthy individual doesn't get infected because you have a good immunity. COVID patients, because as a part of their multiple illnesses which they are already having on the lower side. Second, once those who are getting treated, they have steroids as a part of their treatment. It's beneficial on one side, but they act by reducing the immunity. So the inflammation which is being generated in the body is subsided. But simultaneously, that reduced immunity also predisposes them to secondary infections. So the fungal infection is another secondary infection that is being developed. So those patients who are on steroid from some other reasons, like from asthmatic patients who are on betamethasone inhalers, or some renal transplant patients or liver transplant that are on steroids. So patients who are already on these immunosuppressive agents, some cancer patients who are on chemotherapy drugs. So patients who are on drugs that reduces the immunity as a part of their treatment, they are more prone to develop this fungus. I hope that answers your question.
Thank you so much, sir. So I would like to take the last question from audience today because we are running short of time now. So we have this question from a parent, Neelam Satish Sharma. So this question is for Lalita ma'am. What should be the eating habits to improve the immunity of kids?
So eating habits, it should be a balanced, wholesome diet. आपके diet is, especially school going children, should be high on proteins. So carbohydrates should be actually little lower, but protein intake should be good. A little amount of dry fruits in their diet actually help, because these help in antioxidants and small multiminerals. So small amount of dry fruits do help. What I find is many a times our diets are such that are deficient in iron and calcium. Calcium will be, if now they're inside, so vitamin D is also cut off. Otherwise, sunlight is a natural source of vitamin D, where children would run in the school, have PT period, they would have some exposure. So including some amount of milk products, not essentially milk, it could be even curds, cheese. These are also good forms of vitamin D. Sunlight, of course, is a natural source. For iron, there should be like good hair, good anar, green leafy vegetables. These should be a part of your diet, and of course some amount of dry fruits, high on protein, some sort of dal or eggs if you eat non-veg, or it should be a part of your diet. That actually improves your immunity. There's no one particular food which will help.
Thank you so much, Dr. Lalita. On behalf of St. Edmund's School, Malvinagar, I give a really heartfelt vote of thanks to all three doctors who have participated from three different cities with us on the occasion of National Doctors Day. It was a wonderful session with you all, and we learned a lot about all the myths and rumors that were floating around on social media. Now we are very much clear about all the things. I'm sure our parents, students, teachers, they also must have learned a lot from this session.
So from the whole St. Edmund's fraternity, it's a big thank you to all of you
For joining us. Thank you
for
for joining us.
joining us. If you would like
Thank you, St. Edmund School, the principal ma'am, Mrs. Monica Bhatia, and the academic head, Mr. Dipen Singh, that you thought of this and actually gave us a chance to interact and talk to all of you. I believe telling our side of the story is also important. So thank you so much for having us on. It was a very nice session.
Same, I would also like to thank the academic dean, Mr. Dipen Singh, and the principal, Monica Bhatia, and my colleagues, Dr. Chetri, Dr. Lalita, and the host, Ayushi, Mamta, Mayuri, and the student representative, Priya and Samriddhi. And thank you the student parents who has put on the questions and made, I think we all try to remove the fear from this COVID. We all are doing treating patients with the same mask which we are advising you. So prepare. We are following the same guidelines. So use this mask, social distancing, hand hygiene, and I assure that if you follow the COVID guidelines, you will see the brighter side of the day soon. And good luck and stay healthy.
Thank you, everybody. Thank you, Ayusha and Mamta, for hosting the show, and then our principal of the school for having invited us to this really nice online thing. All the students who have watched us, the two colleagues who joined me from Jodhpur and Jaipur. Thank you, everybody. Happy Doctors' Day to both of you and to all the other doctors in India today. Thank you.
Same to you, sir. Thank you. It was a great time interacting with all of you.
Thank you. Happy Doctors' Day once again to everyone.
Thank you. Bye. Bye.
Bye.